Hospital-acquired infection is one of the most common, yet easily avoided complications that occur during a stay in a healthcare facility. It is costly in terms of human life and can impact both medical and financial resources. In fact, the Joint Commission has mandated that infection rates, as well as their etiologies, be closely monitored and steps taken to prevent their occurrence. This program will look at some of the basic interventions that can be done to protect patients and staff. Precautions, sterile versus clean dressing applications, core measures, and superbugs will be addressed later in this 4-part series.
Do you know about the chain of infection?
A little bit, but can you remind me about it?
Let's go over it. See the 6 links here? They all need to be present, and it doesn't matter which one comes first. But for simplicity, we will start at the top. The agent is the pathogen, germ, bug, what have you. So let's say our agent is E. coli.
Nasty little bug.
Exactly. So our agent is E. coli. The reservoir is our own GI tract, the portal of exit.
I get it.
Okay. So let's say a nurse uses the restroom and doesn't wash hands, or does an improper job of washing hands. That would be the mode of transmission, the portal of entry. Without proper precautions and good infection control techniques, diseases can spread throughout the hospital and even reach our homes and communities.
That sounds really serious.
It is. In hospitals alone, there are 1.7 million acquired infections per year. This results in increased morbidity and mortality, longer hospital stays, and greater cost to the hospital, insurance companies, and patients. For example, there are standard precautions, which is the term used to describe the practice of avoiding contact with patients' bodily fluids. You can use them at all times and are considered standard throughout the world, not just here in the US.
Tell me more.
There are several different modes by which pathogens can be transmitted. Blood-borne microorganisms are spread by contact with body fluids as well as needle or sharp punctures, while others are disseminated by contact with the skin or through the air.
In this program, we have reviewed the chain of infection, standard precautions, and hand washing. In the next program, we will continue talking about specific precautions, in addition to the differences between clean and sterile technique.